This topic is way too good.
This topic is way too good. Okay, hello everyone. This is part two because we had a technical snafu, but this is the best part. So if you didn't watch the other part, it's okay. So let's see. Let's share this out.
Start here. Yeah.
This should be going through. Oh, come on. There. Oh, there it is.
I see it. We're live. I see it.
We are.
I'm hearing a little bit of echo feedback though, for whatever reason.
Okay.
Let's see. How do we start acting like a doctoring profession?
All right. Yeah. So you're right. So let's share it out. Right. I think that's good.
The PT.
Okay. Let me know when you're ready for the question.
Oh, this is too good.
Okay.
I'm just like salivating here. All right. I'm sharing it to my profile. Share it to my page. This is too good.
Okay. I mean, you were
like on a roll with the mentorship or something.
I don't know. Jeez, that's so crazy. Okay. All right. We're ready. I got the notification. It's shared. Okay. We're good.
Okay,
we're good.
All right, let's do it.
So here is the question. Continuing on. So, with physical therapy, the doctor of physical therapy profession, how do we go from being a doctoral profession in name and practically becoming a doctoral profession? They go again.
Right. Okay, so before we got cut off, right? Before we got cut off, this is the deal. It starts legally. It's boring, guys. And it's okay, but it is a mandatory part of what we are and who we are and what we do. The only way we can start acting like a doctoring profession is if we are legally empowered to do so. That means boring things like advocacy and corporate and organizational membership. It means that we have to go to our local legislators or send those emails that we're told to send another email or make that call. It means that, tweeting amongst ourselves and chatting amongst ourselves in closed groups won't make any kind of difference that we want it to make. It also means that our idea of grassroots needs to go beyond I need all my already happy customers to be happier. That's not going to do anything. If that worked, it would have already worked. We need to reach the people that have yet to be happy, I was talking right before we got cut off, right? Like Gene and myself, we made several videos on this, surveying a lot of the PT community with valuable insights that we got invited to APTA headquarters. We did a whole lunch and learn with the executive leadership, got a vaccines tour, the first ever vaccines tour of APTA headquarters from an outside media group, which we're very privileged and honored and thankful still to, and continuing those relationships because we see it now more than ever that the current leadership really wants to make this change and make this difference. And to be part of that conversation, we need to be part of that conversation internally, and we need to be part of that conversation externally. So whichever state, I was having conversations today over a direct message, right? Like Texas has some of the most passionate PTs I know, but they have some of the worst PT laws I know. And the only way you can change that is by playing that political game and getting in front of legislators, and more importantly, getting in front of consumers. And don't educate the consumers. Don't talk at them, guys. What you need to do is you need to share consumer stories. You have to share patient victory stories. You need to share from their perspective why they should care about physical therapy, or why they should care to make the physical therapist the singular choice healthcare provider for all things physical health. That's where you need to reach. That's how we start acting like a doctoring profession, rather than just calling ourselves one and kind of like flapping our hands going, come on, let's make this happen, but nothing's happening because all the insurance carriers don't want to treat us that way. CMS doesn't want to treat us that way. And, health systems won't treat us that way. But until we get that, we got to stop calling it like, oh, we want autonomy, or we want this, or we want that. No. What we want the general healthcare consumer to vote us in. We want the general consumer to show with their dollars that PT is where they want to be. That's what it is. And when that happens, again, it happens internally and externally. I think I was sharing earlier. Yeah, it was today. Earlier today, I was sharing about my acute care days and how there's this, highly rated, ranked, and pretty much renowned orthopedic surgeon during my acute care days that would call me professor in front of colleagues and especially in front of his patients. And it wasn't because I'm smarter. That's not because I'm better. It goes back to the part one with we're no better. We're all part of the PT fam. And I would argue we're all part of this healthcare system family that we're trying to improve, especially as providers and as clinicians. And it wasn't that, it was a totem pole situation. It was that I had a rapport with this orthopedic surgeon that he knew I had his back and that he has mine. That if people wanted to, I don't know, if they didn't want to wish me well in the hospital setting, that the guy would have my back, and I had his back. I made sure every single one of his patients were very well taken care of, and I've caught some problems that come along the way, because they do, and it's not singular in blame. It's not like, oh, he's a bad surgeon, or, oh, the nurse let the clot happen, right? No, sometimes things just happen, but you're a team, and you want to watch out for the patient, who's ultimately the goal and the prize, the person you're trying to take care of the most. Things sometimes just happen, but the thing is, you don't point fingers. You go, hey, look, let's point directions.
Yes.
Let's find windows and doors and openings and opportunities to pursue together. That's what you want to do. And so, that's a long loop around to say, you want to start acting like doctors? Get the law to say that you can. When that happens, everything else happens.
Jeez. Yeah, that is so crazy. Okay. That is hard to follow up on. But okay, we did get cut off. We had our Jive and Mojo sort of push out there. But Ben, is there anything that you really want to share about growth, about physical therapy, anything that you really just want to get out there?
If there's one thing I can get out there, guys, is it's what my mentor told me. It's be more. He said it in so many other different, more articulate ways than I could, but ultimately his punchline was be more. Be more than the status quo. Be more than what you were taught to be. Be more than what the system prescribes you to be. To be more, it means you have to get uncomfortable. It means you have to be constantly comfortable being uncomfortable. It also means that you need colleagues to keep you accountable. And more importantly, in my opinion, mentorship to open doors and open your mindset to see where the box is. You can't think outside the box until you know that the box exists. You can't think outside the box until you know the shape of the box, the dimensions of the box, the properties of that box. And it's until that point that you can't actually go outside the box. And more importantly, it's not until you're outside the box that you can just take the box and go, see ya, I'm going to do something completely different.
Yeah.
So, first you have to see it in your mind, and you have to see the reality that you can be more. You're not destined to a low-ball salary as a new grad. You're not destined to just working home health or just working SNF as a PTA. You're not destined to a corporate lifestyle or this lifestyle or that lifestyle. You're part of this doctoring profession as a family, no matter what your license is, no matter what your title is, no matter if you've been here for 2 days or for 40 years. And that's some of the most inspiring things I'd ever see is that, these owners that have been our trailblazers, some of the ones I look up to the most, insist on their DPTs being called doctors, calling themselves doctors, being called doctors by MSPTs and BSPTs, and even those that hail from the RPT generation, by their OTs, by their aides, by their receptionists, because it helps elevate the entire brand of allied rehab professionals. And it's that mindset, where you hail to the family win, that if somebody else is doing well, that's only elevating the rest of us. When you have that kind of mindset, that changes everything. So I think I want to say Snapchatted it, I think this past week, something, I think it said mentorship plus accountability times strategic partnership equals accelerated success. And I'll leave you with that.
Yeah, that's awesome. And I guess from my perspective as the DPT student is, well, once you graduate, not to just stop there with whatever it is that you want to do, and not to limit yourself to just going to clinical CEU courses, just whatever it is you want to do. But yeah, that was perfect, Ben. I really appreciate it. And where can people find you? You did mention Snapchat, but where can people find you on social media?
Guys, I'm practically everywhere, and outside of my Dr. Ben Fung Facebook page, I'm pretty instantaneous when it comes to responding. So I apologize for you guys that have reached out that very recently. But all my handles are Dr. Ben Fung. That's just DrBenFung. Snapchat, Instagram, Facebook, Twitter. My phone number is 470 Ben Fung. You can call or text that. It's a Google Voice number. It comes straight to my phone. Texting, obviously, to tell me who you are is helpful, and then we can strike up a conversation. And you can, of course, email me at ben@updocmedia.com. And if you're looking for, if you're a student looking for helpful information, UpDoc's blog is great. The Therapy Insiders podcast is great. It's all on updocmedia.com. If you're looking to expand as a PTA or as a fresh PT, or even, honestly, that's one of the growing populations within our Pathfinders mentorship group, shout out. Starting tomorrow for fall session, is seasoned clinicians in like the 8 to 12 year brackets going, I got to break this mold. And there's stuff there for you too. It's just good content from the heart of colleagues that care about each other, that want to help elevate the profession. So, check that kind of stuff out, and feel free to reach out. I'm not hard to get a hold of, and have been known to take long walks on the park or the beach, on phone calls, just to have conversations, because I feel that's where things start, is by just having a good talk.
Yeah, having the good talk. And quick pitch for me, for those of you who may already know, but for those of you who don't know, I am the host of the Capable Body podcast, and I'm really excited because coming up next week and this month are some really awesome patient story podcast episodes. So definitely look forward to that. So Ben, I'm going to let you go ahead and close this out. Any parting words?
Parting words. If you want growth in the field of physical therapy, help grow it.
Yes. Awesome. All right. Thank you very much, everyone, for tuning in, because I know it's so late. We're on West Coast Pacific Standard Time, but all right. Thank you and have a good one. Adios and good night.